So in today's session, we would discuss about the thoracic vertebra, osteology of thoracic vertebra. Here is an image of the posterior view of rib cage where you can see the 12 thoracic vertebra which are strong and are located in the middle of the vertebral column. So here are the thoracic vertebra. So vertebrae on the posterior view articulating on each side with the ribs. So these vertebrae are sandwiched between the cervical ones above and lumbar vertebra below. Like typical vertebrae, thoracic vertebrae are separated by intervertebral disc. So here is the lateral view of the vertebral column where we can appreciate the thoracic vertebra which articulates on either side with the ribs. From here to here is the thoracic vertebrae. And we can see the intervertebral disc which are present between these thoracic vertebrae. So there are 12 vertebrae connected with intervertebral disc, and intervertebral disc contains the nucleus pulposus and annulus fibrosus. So first we shall discuss with the parts of the thoracic vertebra. Normally thoracic vertebra has two parts, that is the body and vertebral arch. This is the body and the rest of it is the vertebral arch. So from here, so the body and vertebral arch enclosed a foramen called as vertebral foramen, in which lies the spinal cord surrounding by its meninges. So these thoracic vertebra, they are identified by the presence of costal facets. So costal facets are present on the sides of their bodies. So we can see here the costal facets. So these costal facets articulates with the heads of the ribs, and these articulations are the characteristic features of thoracic vertebra as they are not found in cervical, lumbar or in sacral vertebrae. So these articular facets which are present on the side of the body, on either side of the body, are the cardinal features of the thoracic vertebra. So if you observe here the thoracic vertebra, the size of the thoracic vertebra increases gradually from above downwards. So as we see, the lower thoracic vertebra almost is larger and the upper thoracic vertebra looks almost like cervical. So the lower are lumbar type and upper are cervical type. So therefore the body of T1 vertebra is cervical in type and the body of T12 vertebra is lumbar in type. In a typical thoracic vertebra, the heart-shaped body which is massive and increase in size as descending into the lumbar vertebra. And let's see some common features. The spinous process, that is the dorsal bony prominence. So this is the spinous process which is a dorsal bony prominence. Costal facets, superior, inferior and transverse facets. So here over the body we saw the superior and inferior, and this is the transverse costal facet. So these superior inferior facets articulates with the heads of the ribs. The transverse process, the bony transverse process that arise from the vertebral arch, intended to have attaching to the rib of the tubercle. So here the tubercle articulates with the transverse process at transverse costal facet. So apart from the costal facets, the vertebra presents a normal facets which are the superior and inferior articular facets, Superior articular facets are here. So this is the superior view of the thoracic vertebra where we can appreciate superior articular facets. Superior articular facets articulate with the preceding vertebra, and inferior articular facet articulates with the inferior vertebra. The lamina that covers the subjacent vertebra and connects with the pedicels to protect the spinal cord, and lamina converges posteriorly to form the spinous process. So this is the laminae on each side. Intervertebral foramen, paired foramina, one on left, one on the right, are present here. These are the gaps between the two vertebrae are the intervertebral foramen. So these foramina are intended for exiting nerve roots from the thoracic segments of spinal cord. Vertebral foramen, we know it is the large opening between the posterior to the body, and that forms the spinal canal through which the spinal cord passes through. So these were the common features of a thoracic vertebra. Let us see some special features. Special features of a thoracic vertebra is presence of facets over the transverse process for the joints with the ribs of all ribs except for 11th and 12th vertebra. So except 11th and 12th, all other ribs articulates with the transverse process here where a facet is present, which are the costal facets. So the unique features of the body presents costal facets which are actually demi-facets. There are larger costal facet, and inferior one is the smaller costal facet. The upper larger costal facet articulates with the head of the numerically corresponding rib. So this one articulates with the numerically corresponding rib. The lower smaller facet, which is also a demi-facet, articulates with the head of the next lower rib. So suppose this is T4 vertebra. So the upper articulates with the fourth rib, and inferior facet or the lower facet articulates with the fifth rib. And next, about the spinous process. The spinous process is more pointed than any other vertebra, and it makes a sharply downward angle. So you can see it is downward directed. So this is the spinous process, which is obliquely downwards. And body of the thoracic vertebra is somewhat heart shaped, and body is smaller than the lumbar and larger than the cervical vertebrae. So according to the features, the thoracic vertebra now we can classify into typical and atypical thoracic vertebra. So the typical thoracic vertebrae are 2nd to 8th. So 2nd to 8th are typical thoracic vertebra, and atypical are 1st and 9th to 12th are atypical thoracic vertebra. So first let us see the characteristic features of a typical thoracic vertebra. So first foremost characteristic feature is the presence of articular facets on each side of the body on front of the transverse process. So here is the transverse process. So just in front of the transverse process we can appreciate these facets. And the transverse process also has an articulating facet. So this is the articulating facet which articulates with the tubercle of corresponding rib. And the spinous process, if we see in a typical thoracic vertebra, it is long, slender and directed downwards. And pedicel is attached to the upper part of the body and thus making the inferior vertebral notch deeper. So here is the pedicel. So pedicel attached to the upper part of the body, making the inferior vertebral notch deeper. This is the inferior vertebral notch, which is deeper. So these are the common features of a typical thoracic vertebra. Okay, let us move on with the atypical thoracic vertebra. So the T1, it is the atypical thoracic vertebra. So here is the image of T1. It resembles like seventh cervical vertebra because it is a transitional vertebra. The body is narrow anteroposteriorly, and if we observe the superior costal articular facet which is present on the side of the body is not demi-facet. It is a complete circular facet. So this is a complete circular facet. So by seeing this you can identify it as first thoracic vertebra because this circular facet articulates with the whole of the facet of head of the first rib. And next feature is the superior vertebral notch, which is seen here. This is the superior vertebral notch and here is the inferior vertebral notch. So superior vertebral notch is little more prominent than any other vertebra in thoracic first vertebra. And if you see the spinous process of T1, it is more prominent and it is horizontal. So it is not oblique, it is horizontal. Horizontal spinous process, and it can be palpated at the back of the root of the neck just below the lower end of the median nuchal furrow, that is below C7 vertebra. The spinous process of T8 vertebra is the longest and backward slant decreases, and at T11th vertebra, that is the 11th thoracic vertebra, the spine is directed almost downwards and it is termed as anticlinical vertebra. So one thing we can note here at this point, that the spinous process of thoracic 8, that is T8 vertebra, it is the longest among all the vertebra, and the back slant, as we move downwards, this back slant decreases, and at 11th vertebra the spine is directed almost downwards and it is termed as anticlinical vertebra, and below this level the spine slants dorsally and backwards. The spine provides attachment to supraspinous and interspinous ligaments. The thoracic 9th vertebra is atypical vertebra. It is identified by presence of only superior demi-facet. And you can see here there is no inferior demi-facet over the body. So the lower costal facet on each side of the body is absent in T9. The body on each side possesses only a superior costal facet for the articulation of 9th rib. So 9th rib articulates here with the superior demi-facet. So this is about the 9th thoracic vertebra. So next about the 10th thoracic vertebra. 10th thoracic vertebra is identified by the presence of only a single large complete costal facet. The body on each side possesses only a single large facet which is for the articulation of the 10th rib. The costal facet encroaches the upper part of the pedicle. And next atypical vertebra is T11, that is the thoracic 11th vertebra, and here it is identified by the presence of single large costal facet. So you can see here. And absence of articular facet on the transverse process. So there is no facet over transverse process. And body on each side possesses a single large circular costal facet for the articulation with the head of 11th rib or the floating rib. So we know the 11th rib or the floating rib doesn't have the tubercle. So as it is not having the tubercle, so there is no facet over the transverse process of 11th thoracic vertebra. The next vertebra is the 12th thoracic vertebra. The 12th thoracic is a transitional vertebra. It almost looks like L1, that is the first lumbar vertebra. And it is identified by the presence of single large circular facet extending onto the root of the tubercle. So the presence of single large facet extending onto the root of the tubercle is foremost important feature to identify it as T12 thoracic 12th vertebra. So this facet which is present in the lower part of the pedicel. So this is pedicel. So it is present on the lower part of the pedicel. And transverse process is smaller and presents 3 tubercles just like a lumbar vertebra. So the tubercles are superior, middle and inferior tubercle. So here is the superior tubercle, middle, so we can see the superior, middle and the inferior tubercles, which are the unique features of T12 vertebra, and there is no facet over the transverse process. So the transverse process is devoid of articular facet as the 12th rib has no tubercle. So the 3 tubercles of the transverse process of 12th thoracic vertebra corresponds to that of lumbar vertebra. So superior tubercle corresponds to the mammillary process of a lumbar vertebra. Middle tubercle corresponds to the true transverse process of lumbar vertebra, and inferior tubercle corresponds to the accessory process or accessory mammillary process of lumbar vertebra. So distinguishing features of atypical thoracic vertebra, T1 resembles as 7th cervical vertebra. Superior costal facet is circular and superior vertebral notch is deep and clearly seen. So these are the features. And T9 presence of only superior demifacet and absence of inferior demifacet. And T10 it is identified by the presence of only single large complete costal facet. And T11 presence of single large costal facet, absence of articular facet on the transverse process. T12 resembles as L1, that is the first lumbar vertebra, and presence of single large circular facet extends onto the root of the tubercle, and transverse process presents 3 tubercles, so superior, inferior and lateral tubercle, and transverse process is devoid of articular facet. So these are the distinguishing features of atypical thoracic vertebrae. Okay, let's see the muscles affecting the thoracic vertebral function. So spinalis muscle, this is a long muscle that is a part of erector spinae bundle of muscles and tendons which helps the spine with the movement and also helps in maintaining the posture. The ligaments of the spinalis muscle attached to the multiple thoracic vertebra, while it is narrow near the first thoracic vertebra and the lumbar vertebra, and the muscle is wide in the middle of the thoracic region. Next muscle is the longissimus muscle. This is a long muscle lateral from the semispinalis and it travels upwards and the spine from the middle of the lumbar spine and is found to run along both the sides of spinalis muscle. Let's complete this osteology part with some clinical aspects. So interesting fact regarding intervertebral disc, people are on average roughly 1% shorter in height when they go to bed at night. The next the clinical aspects which are associated with the thoracic vertebra are the herniation of disc. Herniated disc, when the intervertebral disc is under heavy stress such as lifting heavy object, the disc will bulge laterally and excessive stress will cause the annulus to crack and the nucleus pulposus to ooze out of the cracked space in the annulus fibrosus. So this is called as herniated disc. So due to the lack of a functional disc between the two vertebrae, increased pressure can cause and lot of spinal cord pain may occur and create a might higher risk of bone fracturing and damaging of adjacent vertebral bones. So since they will rub each other directly as the intervertebral disc is depleted here in this region. The next clinical feature is associated with the thoracic vertebra is excessive thoracic kyphosis, in simple terms known as humpback or hunchback. It is characterized by an abnormal increase in thoracic curvature resulting in the vertebral column to curve posteriorly. So this abnormality can result from the erosion of anterior part of one or more vertebrae. And in women or due to older age and osteoporosis, so this excessive thoracic kyphosis is termed as dogger's hump, and this kyphosis may also occur in elderly men too. Progressive erosion and collapse of vertebrae also results in an overall loss of height, and excess kyphosis leads to increase in the anterior-posterior diameter of thorax. So this is about the kyphosis of thoracic vertebrae. So this completes the osteology of thoracic vertebra. Thank you.